Welcome to another just-in-time video series from the RAPUM group. Today, we're going to be talking about considerations in pediatric disaster nutrition preparedness with Joe Miller, who's a registered dietitian and an expert in disaster preparedness specifically for healthcare providers. Joe, do you want to just give a quick rundown, a little introduction here?
Yeah, no worries. Thank you so much for the intro. My name is Jill Miller. I'm a registered dietitian, and my background is public health and public health nutrition from UC Davis. I am vice president of nutrition at Meals for All, so I kind of work a little bit on the food manufacturing side. I work on the healthcare side, and I'm also adjunct clinical professor at University of Pacific in public health over there. But I've held roles from food service director, clinical dietitian, corporate dietitian. And so I've worked on a lot of different spaces, whether it's peds, behavioral health, hospitals.
Awesome. Um, can you tell us a little bit about why nutrition? I think it's a sort of underappreciated fact that in the middle of any given disaster, like you're gonna need a sandwich, right? And
Yeah.
be you a patient or a provider.
Yeah, 100%. As a dietitian, of course, food is my main focus. I love food, but let's be real, in a disaster, everybody has to eat. And generally, you want to eat 3 meals a day and you want food that's familiar, comfortable, and gives peace of mind. And so that's one of the considerations that if you put a little thought into what you're providing, whether it's home, at work, in the hospital, at your academia, a little forethought could go a really long way in planning your meals.
Yeah. I guess I think about nutrition as being an issue in something like an earthquake, right? Where like there's no highways into your city, there's no power, um, or right, your Fukushimas, your Snowmageddons. But is that thinking about it too narrowly? I mean, where does nutrition become a part of a disaster plan?
I mean, everybody has to eat. You could go 3 weeks without food, is the general rule of thumb. Our rule of threes, 3 days without water. So, in any sort of minor or major disaster, you can see it becoming a critical issue very, very quickly. Food and water, we really lump together as part of your subsistence plan. Um, if you're not eating, you're not focused, you're not thinking. So in a disaster, you got to be top of mind, you got to be really focused, especially if you're on the provider side, and eating is critical to being ensuring appropriate outcomes. And then on the other side, of course, you need to eat for nutrition, for health, but also managing your blood sugar. You may have disease states or health conditions where you require regular meals, and peace of mind. If people aren't eating, things could get really chaotic very, very quick. Breakdown in general rules evaporate quickly. If you look at instances like Katrina and 4 days at Memorial, things changed fast, and some of that had to do with those lack of resources.
Great. Should we go to the next slide?
Oh,
So, right. I mean, you talk about these, you know, the need to provide all these resources, and I think one thing that's underappreciated is uh, that this is not just for these earthquakes, right? This is for like a mass shooter event has a nutritional implication.
yeah. So right now we're kind of looking at the all hazards approach. This is something that everyone from FEMA, Ready.gov, CDC, and CMS, Center for Medicaid, Medicare Services, recommends that everyone do this. Again, whether you're at work or you're at home. So you want to identify the risks, but almost any disaster that can happen has nutritional implications. So whether it's an active shooter, you're still having to meet the needs of your department and feed people throughout that situation. But if we're looking at the slide more specifically, loss of water, loss of heat, gas leaks, loss of power, those four have major implications on food and nutrition services because they impact our ability to prepare meals. So you definitely want to build a plan where you're identifying your risks. So you're identifying those hazards, identifying your vulnerabilities, and then identifying a way to work through each of them while still providing subsistence needs.
So your bomb threat plan for your hospital should have a paragraph on implications for your nutrition folks, right? And how you're going
Exactly.
to be feeding patients in the setting of an active bomb threat. It's a great point. I'd never thought about it because I guess when I think about nutrition, I do think about those weather and climate related or like natural disaster type emergencies. And I imagine that from a statistical standpoint, like you're most likely to see those disruptions in that setting. Is that
Mhm.
fairly accurate?
That is fairly accurate, most certainly. But when it comes to things like a bomb threat, an active shooter, or a lockdown type situation, you're still going to have to provide meals on somewhat of a set schedule, even throughout those disruptions.
Let's talk about like the scope of these disruptions that we see. I guess, weather and climate's probably the biggest ones.
Mhm. So I guess you mentioned Snowmageddon, so that's kind of a perfect example. We're coming to you today from Northern California, and every handful of years we do have these pretty intense storms that hit Highway 80 and Highway 50, which have major implications on infrastructure. They close the roads. We had one of our biggest storms while COVID was still an issue, so we had a major disaster declaration. We had the roads closed, and then we had significant communities in Truckee and parts of Tahoe that still had healthcare providers that were needing to create meals, provide food, and have staff when people couldn't get to work. And so, we saw those facilities thinking ahead, working with a preparedness in mind versus response. And I think kind of going back to that question, that's really the major answer. We should always be thinking of preparedness planning, not response. Because when some of these major issues happen, when these infrastructure issues happen, whether it be a flood or a snow or a fire, if we've prepared in advance and we've built a plan around each hazard, then we know that we can address them efficiently and effectively and just kind of go right into our plan rather than be challenged with creating something just in time.
Let's talk about the the big bad weather and climate disasters, right? Uh, there are seems like more and more of them, and they're all over the place.
Yeah, there are significantly more. If we look at data from NOAA from 1980 to current, we are seeing the trend where we're seeing not only more disasters happen, there's more people living in these rural areas where these disasters are. And so we're seeing the cost of these disasters increase more and more as more people are impacted. So this slide is a resource that I really love using that NOAA creates every year, and it's evaluating $1 billion weather-related disasters. We're coming to you today in July of 2025, and by July 22nd, we've already had 85 disasters declared in the United States and 27 major disasters declared. And that's everything from those recent flooding and the storms in Texas to the straight line winds, tornadoes, and flooding in Tennessee and Kentucky, as well as Missouri. And we're going to see this increase. That's really what the data is showing. As we look here on the next slide, we can see from that 24-year gap, there's really no part of the United States that's not impacted by climate and weather related disasters. And this slide is just looking at the cost and the impact of that in dollars adjusted over time. So we can see the region that we're speaking to you from in California, disasters are not new. We always say you want to be prepared for not if, but when the disaster happens.
Yeah, talk a little bit about preparedness. Like what kind of advice do you give to folks when it comes to being prepared for an emergency?
Yeah, that's great. In general, everyone should have a plan. No matter where you are in the United States of America, you should have some sort of a plan, whether it's at home or at work. Now, of course, if you're healthcare, you're at a hospital, this is required by regulation. You need to have a plan that meets the needs of your patients, your staff, and anyone that may come and seek shelter. And that's, could be the numbers could go all over the place. But we want to build a culture of preparedness because again, a disaster could strike at any time. So having a go bag that meets the needs of your family, making sure that you have a plan that meets the needs of your therapeutic diets, modified textures. A lot of us now in the United States are living in multi-generational households. And so you may be thinking of grandma's diabetes and then your son with a peanut allergy and ensuring that you have the food and water to meet those needs, whether you're sheltering in place or evacuating. So ready.gov has a lot of great resources for the general population that can be applied to building a plan at home. And I'm always a huge fan when the holidays come around. I love giving away go bags. I've never had anybody say, I don't need a go bag. And they're great. You add food, you add water. You could do canned water, has a really long shelf life. And it's a great resource and provides a lot of peace of mind. So again, preparedness versus response.
Yeah, I feel like um, I need to do better at that in my regard, and I also think Rap should start making these for the holidays.
I see
Yeah,
that.
you know.
Yeah.
Let's talk quickly about you say be prepared with the nutritional needs for the people in your family or in your workplace as a healthcare provider. What does that mean? What does it mean to be um, nutritionally prepared? What are the nutritional needs
Yeah.
for the patients that we serve and for ourselves?
Yeah, that's a great question because a lot of times when you look at emergency plans, whether it's something that you saw at the store, a lot of emergency plans tend to be incredibly low in macro and micronutrients. Whether it's the bars that were really designed to prevent kwashiorkor, the distended stomach in third world countries, those are incredibly low in protein, and while they will most certainly keep you alive, they're not necessarily ideal for great nutrition. The Academy of Nutrition and Dietetics Nutrition Care Manual recommends that we are mirroring, your dietary guidelines, that you're meeting the general nutrition needs of everyone. And so I just wanted to highlight what those needs are because depending on where we are in that pediatric life stage, your needs are going to be different. And this will be different based on activity level and also, male or female. So we highlighted some of the references from the DGAs, anywhere from 1,000 to 2,000 calories for your ages 2 to 8. And as we kind of go up along that spectrum, we see similar patterns. There we go. Similar patterns 9 through 13, we're looking as high as 14 to 2,600. Now, one of the considerations when you're building your disaster plan is in general, especially if you're sheltering in place and you're working in a pediatric nutrition scope, you're probably not going to have kids, you know, running a marathon. So your higher scope, you're generally not going to need. You may really focus in that middle range for that life stage. But that does lead well into what your needs may be for staffing because your staffing will be working long days. Your staff will be working long hours. Your first responders will require likely more nutrition to keep that level of care going. So really kind of as we have this conversation, we want to think about not just, sorry, the dog. Okay. Not just the patients, but also, how we're going to keep the nutrition up for our staff. So anything above 2,000 calories is generally recommended. And then here, as we look through, I'm going to say my dog was just walking. So I will go right back to what I was saying. So here's we look through ages 14 through 18, you may need calories as high as 3,200, but generally when we're building disaster plans, we really shoot for something around 2,100 calories. And then you may have supplements. You may have other things on hand that can provide additional calories should those activity requirements be necessary.
Perfect. Yeah. What about for those patients with like the more restrictive diets? People with, I guess anything from just food avoidances to anaphylactic allergies to diabetic needs. How do you incorporate that into your planning?
A lot of forethought. You really want to identify your population in advance. Again, we're We're now moving from response to preparedness, and preparing for disasters is really critical. Part of that is identifying your population and identifying your needs. So if you're a pediatric facility, you may be a nut-free facility in advance, and make sure that that also continues over to your emergency management plan. You may be getting donations. A lot of times, especially in different states, they really rely on memorandums of understanding, and they may be getting donations from local restaurants. We see that quite a bit. So, really having that communication, which could be a bottleneck, and identifying those restrictions and things you cannot accept are critical in advance. Um, Kind of back to that first question, identifying, do we have diabetic patients? Do we have the ability to meet those needs? When you're diabetic and you get stressed out, your blood sugar spikes. So, do we have the medication to manage that should we need more? Nut allergies are a huge challenge, and I myself do have anaphylactic peanut and tree nut allergy. So, you're always having to pre plan. I travel with snacks. And then, other challenges, restrictions, whether it's keto diets recommended to manage um, different disease states, whether it be, I'm sorry, I'm losing the word right now.
Like
Um,
seizure disorders or
we use that diet to manage seizure disorders. Yeah, is that what you just said?
yeah,
Uh,
seizure disorders, epilepsy, right? Like that's
yeah, yeah,
becoming all the rage now.
yeah. Well,
And it's a
that's
real problem if you give those kids a candy bar. So yeah,
it is a real problem. Okay, so I'm going to step back. So, whether it be a keto diet that we're using to manage seizure disorders, we really want to think about these things in advance. And the last thing you're thinking is, I have to have a keto diet, my disaster plan. But if that's part of your population, just a little bit of planning in advance could really, really mitigate some challenges down the road. And to your point, same goes for vegetarian food avoidance challenges. If you could manage those in advance, a small amount of forethought is going to go a long, long way to not just feed your population, but help with peace of mind. Because food, especially when you have comfort and familiar food, it goes a long way to help people understand it's going to be okay and to
right.
calm some of those stressors.
Yeah, I mean, it's a huge component in just the psychological response to disaster, which I think tends to get sort of minimized. But food riots are a real thing, and are definitely going to throw a wrench in any other disaster preparedness you're trying to do. Talk about, if you could, a little bit about what we're talking about when we talk about disaster food planning, right? Because it's presumably unlikely that you're going to have refrigerators and gas stoves and fully staffed kitchen that can prepare meals on order, right? Like this is
Yeah.
the omelet station's closed. What are we doing now?
Omelet Station is most certainly closed. We always recommend, from a food and nutrition services perspective, start with your dry storage. And if you have perishables, do your perishables first if you have the ability, because in general, perishables need to be cooked. And this goes for at home or at work. So if you're at home, electricity goes out, either don't open your fridge, have a hard rule to keep it closed the whole time, or if it gets to the point that you have to start utilizing it, use those perishables first, and then move to your dry storage. And that can be your canned goods, items that you have there. The challenge with dry storage in your canned goods and your perishables is that is contingent on having staff that can read a menu, that can scale. At home, it's not a problem, but if we're doing kind of like large food service situations and your staff is on the other side of the bridge that you can't cross because the earthquake and they've closed it, then you're going to really need to go to your disaster plan. And this is where a little bit of forward thinking can go a long way. So whether it's at home or at work, anything from supplements to freeze dried and dehydrated foods, MREs, meal bars, all of those can be fantastic components of a well thought out emergency plan. And every American should have some of these components, within their plan at their home, whether it's in a go bag or, in a shed that you're rotating or a pantry that you're rotating regularly.
At the facility level, like how do you think about that in terms of, um, you know, and I assume that our folks at our big hospital have thought about this, but like, how do you know how many MREs to have? How much freeze dried whatever? Like,
I
how do you make that decision? How do you plan for that?
actually, Jonathan, that's such a great question. The California Hospital Association has a fantastic tool. It's a food planning and guidance toolkit. And it actually allows you to do just that. You plug in your numbers, your licensed bed, and then you create a staff to patient ratio. And it allows you to even look at people that are off site. You're able to look at your physician count, your visitors, your volunteers, family members, and you can actually bring that to your safety team, bring that to that interdisciplinary team that should have food and nutrition services, emergency management facilities, your physicians, your nurses, and through that, evaluate your needs. So the tool is fantastic. It's free, so it's not kind of held up by a paywall with the California Hospital Association. Whether you're a small facility or you're a major hospital, it's very easy to access and utilize.
Oh, fantastic. That sounds great. And we can add a link to that
Yes, sir.
in the show notes. Water.
Yeah. Water is kind of funny. I've been working in food as a dietitian now for over 15 years. And as just a consumer of food my entire life, because I do love to eat. This is why I became a dietitian. But water is interestingly the space where I get the most questions. People have the most challenge storing water because, in general, bottled water really only lasts a year. We should have 1 gallon of water per person per day. And that's for drinking and for food prep. And that's for everyone in your household, also your dogs, your cats, your pets, things that a lot of times we really forget as we're building these plans. This also translates to healthcare. When I say 1 gallon of water per person per day, that's just food and nutrition services. So that's not going to be enough water if there's surgeries or hygiene challenges, but 1 gallon of water per person per day will provide that half gallon for drinking and then provide you at least a half gallon for food prep.
Uh, Obviously, not all populations are the same. And I think we are increasingly recognizing that different populations that you slice and dice in different ways have unique needs. I assume that is also true in the nutrition space.
Oh, yeah, most certainly. Depending on your stage of life, we put a lot of focus in highly vulnerable populations and identifying where those vulnerable populations are. It may incredibly change the needs that you need at a healthcare facility. Um, there's a really nice tool, again, the Social Vulnerability Index, that helps us identify some of these challenges. So when we're thinking from a pediatric standpoint, we could utilize the Social Vulnerability Index to identify if we're in a region with a lot of children 17 or younger. So we may need to dedicate more resources because that surge component, and surge is anyone from the community that may come and seek shelter. So it allows us to identify how much surge we may get to our facilities. So these indexes are fantastic to help us do that. On the other side, when we're thinking about just general dietary needs, whether it's renal dialysis or diabetes or other disease states or texture mods that are required, that's just pulling your diet orders in advance, doing a little bit of planning, not even a lot of planning, just looking at your average census and realizing that we have to meet these needs. We need to work these needs into our plan.
That's awesome. I think so important, right, to have a plan to have a nutritional plan as part of any disaster plan, and to have that plan be based in good data and reality and in a concrete assessment. It sounds like there's these amazing tools between Social Vulnerability and the Children's Hospital Association link. Like, what happens if we don't do that, right? Like, what are the implications of being inadequately prepared with your nutrition plan?
I mean, being inadequately prepared. We've seen these examples historically in the United States and throughout the world. I think the one that really comes to mind, of course, is Katrina. Katrina was a major disaster, and the implications were had many knock-on effects. So we had an instance where in the region, when the Office of the Inspector General went into the Gulf and looked at healthcare facilities, they found that 100% of facilities had a plan. And, 82% of the facilities were training and testing their plan. But everybody failed to be able to put that plan in place effectively. And so if we look at, the area of the Gulf, we found that everybody was impacted in that disaster. And the knock-on effects were very, very visual. We look at the challenges at Memorial Hospital and 4 days at Memorial, and not having the ability to manage some of those resources and the pandemonium that then ensued. So having a good plan, ensuring that you have food and nutrition to manage not only your patients, your staff, but also that potential surge that may come and seek shelter. And again, that was a major disaster, but it had many implications. So the knock-on effects could be everything from supply chain challenges. And supply chain is an issue that I've always talked about as this could happen. But then the pandemic showed us, oh no, this is real. This did happen. And it created major challenges throughout the United States and throughout the world as it relates to food and nutrition services. But also knock-on effects increase morbidity and mortality. We see that after every major disaster in our highly vulnerable populations. So whether it be pediatric or aging populations. Hygiene issues is a knock-on effect that we oftentimes don't consider with food and nutrition implications. Hand washing, norovirus outbreaks we see often during a disaster, but a little bit of planning, creating a hand washing station, making sure that we have a portable hand washing station, sanitization equipment, and training resources can go a long way to prevent those issues.
Awesome. Yeah, I think that right, all these knock-on effects are just uh, so important to remember, and I think so often overlooked. And I saw this slide that this formula example is a really nice example of how you can line up all the holes in the Swiss cheese in this sort of nutritional catastrophe.
Yeah, this was an interesting one because a lot of times in my space, we talk about emergency plans and disaster plans. And this was a situation where it definitely was an emergency. Abbott Nutrition had noticed, there may have been bacterial contamination. They had some concerns. So they started pulling some formulas. And then eventually, due to the knock-on effects of that contamination, there was a massive recall. What wasn't anticipated was the COVID-19 pandemic just exacerbated those supply chain challenges. So we went from having an emergency to, for many Americans with infant children and children that are requiring formulas, it really became a disaster throughout the United States, where we had to change policies and where we were sourcing things, and rethinking where some of these contracts and productions are happening. So it was a really interesting example of a knock-on effect affecting major supply chains, while one major disaster, the COVID-19 pandemic, coupled with this emergency, really spiraled quickly.
Fantastic. Well, Joe, thank you so much for taking the time to talk with us. And I think what a just incredible reminder of the absolute centrality of nutrition and nutrition planning, and the incorporation of a nutrition plan in your disaster plan, for all our folks who are wanting to be prepared at home and at work. This is just amazing work. Thank you so much.
Yeah, well, thank you so much, Jonathan, for the opportunity to spend some time with you all and talk about food and nutrition and how critical it is in this space. And we always say, don't let your disaster plan be your next disaster. And wishing you all a safe and prepared tomorrow.
Wonderful. Thank you so much. And we will have the slides from this talk available for download as a PDF, including references that you can use to find more information along with links to some of the things that we describe in this really excellent, wonderful recap. Uh, 3 weeks of knowledge in 20 good minutes, and we really appreciate it. Thank you so much.
Yeah, thank you so much. Bye, everyone.